Welcome to Straight to Why, where we bring you conversations and insights uncovering the why behind the companies, people, and ideas that are transforming our world. Today, we're really pleased to be at Baker Health with Dr. E. Baker. Dr. Baker, thank you so much for joining us. We're going to be chatting about health, longevity, and overall well-being, including concierge medicine, which is obviously your area of expertise. So where I'd like to begin is where the Baker Health origin story came from and what your goal for the business is in the future, and really why concierge medicine.
Sure. First of all, thank you for coming, and it's a pleasure. I'm a family practice doctor by trade. I come from a background of many doctors. My father was a pediatrician in Hudson County. My two brothers as well went into pediatrics. I decided to do family medicine. So we sort of grew up in the entire healthcare environment, from growing up and not barely being able to walk to seeing how my father used to run to the hospital, cancel trips and things like that when my mom was alive. And that sort of put us all on the track with no pressure from their end. And I guess we just followed in the footsteps.
In the blood?
In the blood, I guess. We went into the traditional sense of how healthcare is run, the traditional fee-for-service world, all this kind of stuff. And, you know, it was good. It was basically all that existed at the time. And in us becoming doctors, our mom actually got pretty sick, and she had a condition called scleroderma. She actually ended up passing away from it. So for us, growing up, watching our dad as a pediatrician, and then being on the receiving end of healthcare from my mom, her basically second home was the emergency rooms because of lack of access, lack of communication and things like that, and not any knock on any doctors or anything of that nature. It's just sort of how it was. She'd wake up a little bit ill, and we'd call the doctor, and like clockwork, the next appointment is in 3 months, and she would end up in the ER and get a blood transfusion and all this kind of stuff. So what that did is it sort of shaped how all of us think. And it said, wow, we're giving care. And at the time, we were also open 7 days a week, take calls, do all this kind of stuff. So even in the traditional sense of how the fee-for-service world was, we would still do everything we can to have the utmost accessibility because we saw it with our own family members.
Sure.
And then we ended up joining our father, who had pediatric practices. I joined, did the adult primary care, and we built a pretty large company. And then we joined a corporation and saw the entire aspect of the healthcare system from the corporate life on how the payers do, the PBMs and all that kind of stuff. About 6.5 years ago, myself and my brother said, you know, it's time. He went to go do his thing as in Baker Pediatrics, and I started a company called IZ Medical. I actually named it IZ Medical because I wanted Izzy Medical. That was my mom's nickname, but that was taken in a company in California.
I see. Too bad, because that would have been very sweet.
That would have been cool, yeah.
Yeah.
So it ended up being Iz Medical. And then my brother and I merged together, Baker Pediatrics and Iz Medical, and called Baker Health. And what we decided to do was basically build a company that we would want to be members at, and basically fix every single problem that we felt when my mom was ill. So any decision that we've ever made is to make sure that the member experience is exactly that of having a doctor that's in your family and you have accessibility to. So when we do things like the beating heart of the company is the chat. A chat, which is like HIPAA compliant to get all the compliance issues. And it's basically any member that is part of Baker Health, they can message us no matter what zip code there are, which continent there are, for anything that's something as small as a cold, all the way to I traveled and I got diagnosed with X cancer. And then we'll coordinate everything for them. But what they know is we basically are in their pocket and they can utilize us at any time.
And it's for the whole family, right? And then how do you think about, because One thing certainly we hear in the healthcare industry are concerns around costs.
Sure.
How do you think about affordability? And just by way of background, what I would say to you is, in selecting Baker Health for this episode, I did some primary research to look at affordability of other concierge clinics. And they didn't offer as much as you do at the prices you offer. So I'm curious how you thought of affordability as a
Sure.
part of that equation.
Sure. So there's a lot of concierge practices that are out there, good quality doctors, good companies, but they price out a lot of folks. Their focus is purely on those folks who have, I don't know, well, $5, $10 million, whatever the dollar amount that they can afford is. That is not the initiative that we decided to choose. Our goal is to not have a membership so we can get rid of folks. It's purely because our focus is to keep people healthy, to actually, which is not how traditional healthcare companies are run, is to actually keep people out of our offices.
As opposed to when they're sick, address the problem.
Correct. And so we've done, like with the chat, if somebody, for example, has a pink eye. So for the most part, there's companies out there, whether they're concierge or non-concierge, that they'll have the doctor's cell phone, or they can log in, do a quick televisit with the doctor they've never seen. It even happens through the insurance company. Sometimes the insurance itself has a telemedicine, and then they'll book them for a telemedicine and do all this stuff, somebody that they've never seen. For us, it's actually, they can message us a picture of the eye, and we'll send them a medication because we made the diagnosis without even having we call them reservations, not even visits. So we actually lose that. And we've done a tremendous amount of investment in the holistic part. So we actually have like yoga classes. We have Baker Studio in every location so that people could come at no cost, just so that they can move daily. They can stretch. They could do all these things to prevent illness.
You also have IV drips, I saw, and you have cold plunge in some of the offices as well.
So yeah, we have partnerships with a lot and collaborations with a lot of places, the cold plunge being one of them, the red light, yearly annual fitness assessments and things like that, so people could actually get to as close as possible, not only their BMI, which is a metric that we usually check, which is the height and weight ratio, to see if they have to drop weight, address blood pressure, diabetes, etc. But also this fitness assessment will tell the percentage body fat and things like that. So we'll do a lot of focus depending on what the goals are for the member to not only fix the numbers, but also to prevent problems for the longevity space, which is the ultimate goal. And so it used to be like 40 is the new 20. Really now, the real focus is that when people are in their 70s and 80s, that they can really do things and not put it to, oh, I'm getting old.
Right.
That's really the ultimate goal. We spend so much time building a legacy, working the whole time. And in doing that, you put so much stuff on the back burner. A lot of times it's your friends, a lot of times it's your family, and almost always it's your health. Maybe too much caffeine, maybe the lack of sleep and all this kind of stuff. And so a lot of our focus is to prevent that. So when people are in their 50s and 60s, that they are feeling like they're in their 30s.
That's amazing. Well, it's wonderful to see. Can you actually demonstrate with data that you get better patient outcomes through this type of intervention, early intervention, concierge medicine, as opposed to, as you said at the outset, waiting until someone is sick? Or is there data behind that?
Sure. So there's really, and again, the data is a constant moving target because the more members come in and you obviously there's a longitudinal approach. So checking data now for about 6 years, obviously we're going to need a little bit more time to see like life expectancy and things like that.
But you have some early indication.
Absolutely. And so like one of them is the total cost of care.
Yep.
The total cost of care from the insurance perspective and the utilization of the members is significantly less than national average. So people, like I alluded to the chat, and not only direct of what we do, we've also created a massive high quality network of specialists. And in order to be in that network, part of it is the same day reservations for the Baker Health members is that they have to be seen within 48 hours. And so all of these types of things have shown to decrease the total utilization about 3.5 visits per year.
Wow.
Per person. And the one that I really like the most, and this is a lot more geared towards the adult side of the practice, is there's about a 22% reduction in the amount of medications that people take once they join Baker Health after 2.5 years of being with us.
That's an amazing statistic.
Yeah, and a lot of that really comes from the focus on the preventative things. Like if somebody does come in and their weight's high, we have continuous check-ins. We also have like a feature that will monitor how many times did they use the Baker Studios. And we'll track them, and it's pretty great when I see, even when I teach the residents and the new docs that come in, I have a basic rule of thumb for them, is if somebody comes in with 10 medications, in 12 months from now, those 10 should be 5.
Okay.
And the numbers should all look the same. And so each year, the goal is to cut back and cut back and cut back. So ideally, people will need medication for certain things, but to try to get people off of any chronic type of medication if needed.
That's very fascinating. All right, I'm going to pivot to the medical side, doctor. One of the things I'm very curious about is peptides. So we hear a lot about them today, but I'm going to say, frankly, I don't understand what they are. So can we start with what is a peptide?
Sure. Peptides are basically protein amino acids types of things. And I think what will clarify peptides, sometimes now with the presence of so much like information from our phones and we're doing a podcast right now. So, right? And there's so many different avenues that people could get their information that peptides have actually been around forever. Insulin is a peptide, right? And GLPs, so semaglutide, tirzepatide, that are much newer. So peptides have really been around for a while. There's just such a massive influx now of so many more peptides. And where did they come from? Why did it become so groundbreaking and basically common nomenclature now? Is because, and I'll use the example for testosterone, TRT, for when a human takes testosterone replacement therapy. Traditionally, if a man has low testosterone, you'd have to check their testosterone level on 2 separate occasions at 8 a.m. and the testosterone for that man should be less than X being 275 for most insurances, and then insurance will go ahead and start to cover that TRT replacement.
Okay.
Now, a doomsday scenario is that you start somebody on the testosterone and then a side effect happens. Either their blood is too thick or some issue happens with their prostate, and now they have to be off of it. Basically, the basement of where they started that was already low, that qualified them to get the TRT, now is significantly lower because any natural amount that they were making now got desensitized.
I see.
The peptides are the ones that, and were pitched, and a lot of data is coming about them now, is that if you start a peptide and it doesn't work or there's a side effect, your natural part is not being deregulated.
I see.
So that's where the juxtaposition between the peptides and the TRT, and just that's one example of like some certain peptides that can help that.
Well, you also mentioned the GLP-1s, which, for listeners, that's versions of Ozempic.
Yeah.
Have you seen a significant increase in GLP-1 prescriptions as well and usage in general?
Yeah, if I remember correctly, I believe that the most prescribed medication ever was a statin. I think now it got taken over that semaglutide and tirzepatide have gone a much higher curve of being prescribed. It's the most prevalent medication I've ever seen prescribed in my career.
Wow, that's fascinating. I know it's used for weight loss and for diabetes, blood sugar management, but are there other benefits of taking GLP-1s? And what are the risks as well?
Yeah. So I'm actually a fan of GLP-1s, but we have to juxtapose like when, for what reason. So if we use it for diabetes, it's been a game changer. And to the example I used about getting people off of half of their medications, they may have been on 4 oral diabetic agents. And then when I introduced the GLP to them, God.
Right.
So
4 to 1.
Yeah, like it's pretty groundbreaking when it comes to diabetes. For weight, so a lot of people will say, Dr. Baker, what's the side effects of the GLPs? Constipation, and there's short term and then the long term that we know of now. Sometimes it can affect the vision, especially certain of the GLPs, but then you can switch them to a different one. My biggest issue with them is for those who are using it for weight loss, that's by far the majority, is that it's such a good medication that it's so easy to be dependent on it. It's like, it's the holiday season now. So everybody is going to indulge a bit, whether it's sugar, alcohol, this, that. And the GLPs really remove it. So the medication has fixed 3 massive health issues, and these are public health issues. Number 1, obesity. 2, diabetes. And 3, I've seen it help significantly alcoholism.
That's fascinating.
Yeah. And so any medication that could fix those 3 problems, the side effects to not recommend it really have to be very high. So I like using them in the short term for weight loss. I'm not against that. But in order to do it, so you don't get the Ozempic face, or what people will say, because the longer you use it, you start to lose muscle mass, cartilage, and bone mass. And that's been proven on bone density scans. The way one can offset that is to really, and they just changed the RDA, the recommended daily allowance, for somebody not on GLPs for protein intake. So my general rule of thumb is if somebody's using it, you have to start them on a set goal of exactly how many pounds are you trying to lose.
Okay.
And once you do that, you define the trail for how long we're going to do it together and increase the dose and what have you.
So you reduce that dependency by cutting it off at that point.
Exactly. And then do a small wean. But they have to absolutely stick to the 1 gram per pound of body weight of protein and exercise.
Okay, but how do you get a gram of protein per I can't.
It's hard.
What do you eat to get that much protein into your diet? Because I personally struggle with that. I cannot get enough protein in every day.
It's very, very hard to do without being on a GLP.
Yeah.
With being on a GLP, it's even harder. It's one of the few times that I actually recommend liquid supplementation of protein.
Okay.
So obviously the eggs, the fish, a little bit hard to digest, especially at the higher doses of the GLPs, the red meats and things like that.
Oh, they cause stomach issues.
It's just harder to digest so much of it because of the peristalsis and things. So a lot of eggs, fish, and protein shakes, but it can be done. It can be done, and that in conjunction with weight training and resistance training. So then you could be on that GLP for a year, and you will mitigate the risks of the decreased muscle mass, bone mass, etc.
Okay, that's really interesting.
And there's a lot of research now in the GLPs and the peptides where they're decreasing. There's like phase 3 trials of ones that don't have that effect on muscle tissue.
What about the new, I think I saw Novo Nordisk now has a pill that's approved. Do you think about delivery mechanism as well?
I do. I mean, right now, there's actually an oral semaglutide called Rybelsus.
Okay.
That's approved for just diabetes, but by far the majority, still the effects have been clinically more significant with the shots.
The jab.
Yeah, I think the absorption part of it has been, and by the way, same with the location of the injection site. Like if you could inject here, thighs, abdomen, and I'm just seeing a better uptick in the results when in the abdomen.
Oh, interesting. Okay. I wonder why. I'm going to pivot to longevity because that's obviously one of the key focuses for you in your mission at Baker Health. And we hear a lot about longevity lately. I hear terms now like NAD, and I'm not even sure whether I'm pronouncing it correctly, glutathione. Mm-hmm. Is that the path that we should be taking to focus on longevity in addition to what you've raised as the preventative medical course?
Sure. So NAD and glutathione are 2 of the newer supplements that have come around. And when I say newer, I mean the way they're being delivered. They've actually been around for a long time. And I think for the consumer, it's very, very difficult to pick which supplements to take.
There's so many.
Like people can walk into the vitamin shop, GNC, if you just go to Amazon or you walk into a ShopRite, CVS, the aisles are just filled with so many different types. And so NAD is one of the most popular ones, as well as glutathione now. And I use the metaphor for NAD as it's the one that makes all the energy, the ATP, it builds everything for you.
ATP?
ATP is the phosphorus that's inside of the body that gives you energy.
Okay.
And so it does everything on the level of sort of like if you have a garden, the NAD is the water that fuels the garden. That's what it does to your body. The glutathione is the one, it's more of a protector. So it doesn't build as much. It basically prevents the damage and things like that. Like it oxidizes certain things. But each one could have a lecture in and of itself for like 5 hours because there's so many building blocks to get there.
Right.
And the results for both of them have been pretty good. And the delivery system of them, I think, is where the results have gotten beneficial because a lot of these supplements that we talk about are not nearly studied as much as the GLPs.
Right.
Those go through phase 1 trial, phase 2, and all this stuff. The supplement world, you don't have to go through all of that, right? It's not FDA approved like this, and all this stuff. It could be not banned. And so a lot of it is basically after it's out there, then there's market research that will happen. But the way NAD and glutathione are being delivered now, they used to be like NAD was oral, but the studies show that you couldn't get enough of it to increase in your body to actually have the desired effects.
Okay.
And that's why the IV infusions or the intramuscular have actually shown some good preliminary research.
How often would you need to, let's say NAD, for example, how often would you recommend for an average patient, middle-aged, great, good general health?
Yeah.
How often would you recommend that type of treatment?
For the most part, it's about once a week.
Wow.
It's about once a week. I have seen people do twice a week. They'll go once a week for about 3 months. It's not cheap either. It's like $150 a shot. So I like to do 3 months, see how they do. And then once they've had enough of a boost, then see the oral supplementation for the next 9.
I see. Okay.
Yeah.
That makes sense. Okay, let's talk a second about health wearables. I know we talked a little bit about data at the outset, but health wearables are everywhere now, whether it's Apple or the Oura Ring, and there are many others. Do you think that they're helpful, and do they help you in your practice? Do you recommend that a patient use that type of device to give you better data?
Yes. I'm a fan of all the initiatives of getting more data on the human body, which a lot of folks, when I discuss with them, a lot of them believe that it just increases anxiety for people because they just keep watching it and watching the numbers.
I've heard that case made.
Yes, and it's true. Some people, if you're watching the blood pressure machine and you're checking it yourself, it's definitely going to increase. However, regardless of the cause, whether it's anxiety or a different reason, to have all that data really does help. It helps a lot, and I'll give a prime example. To me, the most beneficial thing created for diabetics, much more than the GLPs, much more than the pills, is actually the continuous glucose monitor, which is a device there. And the reason that's so effective is we use terms as doctors like, this patient or so is non-compliant. And then I'll sit and I'll talk to the doctor and say, why is he non-compliant? Oh, he didn't check his sugars. Then I'll say to the doctor, well, he didn't check his sugars or take his medication because they have to stick their finger 4 times a day.
Which is awful.
Which is awful.
My mother did that.
Your mom did. And they have to inject insulin 4 times. So you're sticking somebody 8 times a day with that. That's not really non-compliant. That's just sucks. Right?
It's just terrible.
It's terrible. And so the continuous glucose monitor is so easy that I've seen so many people benefit without more medication, just because when they're going to have that second slice of a pizza or what have you, they basically check their sugar on real time, and that's been putting it in their head and preventing them from having the second or third course.
Well, that's interesting. And does that get injected into you? Yeah. So it sits underneath the skin?
Yeah, and it's replaced every couple of days.
Okay.
And it's got Bluetooth, so it's attached to your phone, and you'll basically just swipe it.
Okay. Are there other devices like that we should be thinking about moving forward? Do you see anything new coming on the horizon?
Yeah, I mean, with AI in particular, there's a lot of initiatives that I've seen, and I think they are good for the most part, so long as not tremendously you don't want anything obviously to be abused and things like that. But yeah, the rings that monitor your heart rate, your oxygen overnight. One of the most underdiagnosed diagnoses out there is sleep apnea.
Yep.
And how many people know they have it? Well, these rings could go ahead and help find it. Now, the accuracy of them, and I'll give a lot of these companies a pass because they have to get their data and then go ahead and adjust
It
as
is
it's warranted.
continuous improvement.
Right. But for the most part, I'll give that, I'm a fan of them.
Okay, that's helpful. So I want to move to mental health and behavioral well-being, because one of the things that I really liked about your practice when I was looking at concierge medicine was you also include mental health and well-being when you think about the patient. And for me, that's important because it's the whole body, the whole mind, it's all connected. But I'd love to get your views on what you're seeing in that space. And I'd also love to hear from you on the pediatric side, what you're seeing.
Sure. People look at the mental health space in the traditional medicine as its own specialty. We really look at it differently. We really look at that the mental health space is really part of primary care. Everybody should have a mental health, I would call it coach/check-in pretty regularly, because you have this small amount of time on the planet, and as things change, whether it's work, family, being a mom, being a dad, a friend, and all that kind of stuff, everything will take a toll. And you can't do as much, there's not that much free time anymore.
Right.
And some people just go ahead and keep that in, and it starts to affect them. And it affects them, and they start to not get healthy sleep. And then it becomes a vicious cycle, where then they're not performing at work, then they're on some medication to help them concentrate, and then that medication causes them not to sleep, so then they take a medication for that, and it becomes a vicious cycle. So knowing that that's the case, and I'm very happy to say that the taboo of having a mental health coach or a therapist is no longer there. It's pretty common. Now it happens with any athlete. Half of the NFL players, NBA players, they start missing a shot because they're in their own head. They missed a couple, and they have a mental health coach for that. That's no different than the average person that I can do that. So I'm very happy that people are comfortable saying, you know what, I'm pretty stressed, whether they're male or female. So we've decided to have that in-house where therapists do come. They do it regularly. They're in every location to go ahead and help the members. And exactly to your point, that in the pediatric space, sometimes it goes a bit deeper, because sometimes you need a pediatric developmental or psychiatrist. So we've actually brought that in-house as well in our parental notation.
Okay.
Because the demand is just so high and the need is just tremendous.
Well, that's not good. What do you attribute that to?
I think there's a multitude of things. Like I had a question the other day about autism, and and the question was, did the numbers of autism increase, or did the definition get wider? And that's why there's so many more. It's definitely a combination of the two, that the definition has widened, but that does not negate that there's been an increase. Now, what's the cause of autism? I don't have an immediate answer to that. But the mental health part of it is that a big part is that a lot of the kids, they don't socialize anymore.
Yep.
That they're not around other kids their age. In our time, whenever we had free time, we'd be outside. We'd be playing in the park. We'd be doing this. A lot of it now, they might still communicate, but they may be communicating with an earpiece to their friend. So times are different. So long as we all understand that, it's very hard to get rid of a lot of that stuff. But then we are able to coach the kids and see, well, how is this affecting so-and-so, right? I also find it interesting because a lot of people always, right, they're very generational. They say, oh, my generation is better than this. Oh, these kids are different. It's interesting. I find it also with all the negatives of and how kids don't go outside, they're actually really smart now.
Yeah.
Like if you talk to the average 8-year-old kid, he or she knows a lot more than we did. And I think a lot of it is because of the
access to information.
Correct. But that has I don't know that they're mature enough to be able to detach themselves from that and then go and get that. So that's what
I'm not sure adults are.
That's true.
So, do you think that could be a similar issue for adults?
Yes. I do. I think that it's definitely the phones and the screen time for both definitely plays a big role. But there's so many other distractions and the things like exercise. Like if somebody asks me, what's the number one thing that you recommend your people for longevity or stress relief? Is it the diet? Is it vacations? Is it this? Number one is stress.
Yeah.
Do everything you can, and you really have to identify what's your stressors and sort of just mitigate them, whatever way you have to. And whether it's a therapist, whether it's taking time, whether it's sleeping earlier, and a very close, I wouldn't even call it 2, I'd call it 1A is exercise, is to actually get outdoors as much as possible and just move and sweat.
Is that, so if you're looking to be healthy in 2026, those are your first 2 recommendations.
Yes.
What would be your third?
Nutrition.
Okay. And is that protein?
Definitely increase protein and minimize the, we'll call it junk food, but processed foods and things like that. But as much as I hear people discuss that, it's almost impossible to really omit that. And that's why I put exercise at the top, that you're going to have some meals, no matter what. If you're a parent, you're going to indulge with your kid once in a while at the theater or after school with them. Well, so long as you're going to burn it,
right,
then you're okay. And so like even with dieting and exercising, so if somebody has ultimate goal, the key now in dropping weight, if you want to lose X amount of weight, you drop the weight by diet. You keep it off by exercise.
Mm-hmm.
Yeah.
Mm-hmm. Okay, I want to play a fun round with you. This is called Stay or Go. So I'm going to name trends, items that are out there. Some of them we've already discussed, but I want to get you to gut instinct, say you think it's meaningful and it's stay, so stay, or go, you don't think it's so meaningful and it may not be a significant part of the future in terms of health, longevity, and wellness.
Let's do it.
Electrolyte salts.
Stay.
Stay. Athletic greens.
Stay.
Colostrum.
Go.
Why?
It's not going to be enough time. There's been a lot of discussions about colostrum. There was the beta HCG diet fad in the past. I don't think it's going to have legs.
Okay. Do you heavyweights? Heavyweights, stay. Okay. Lymphatic drainage.
Stay.
Okay. Probiotics.
Stay.
Do you recommend a specific type?
I mean, everybody tried the one that doesn't affect. I mean, obviously, I like mine. We made our own.
Oh, I didn't know that. Okay.
Yeah, a pre and a probiotic, just because no preservatives and no GMOs, nothing like that.
Okay. Creatine.
Stay.
Collagen.
Stay.
The walking culture.
Big time stay.
I hear that. I mean, I already know your answer to that. Weighted vests.
Stay with a caveat that probably I do believe that in our lifetime we'll have a fix for Alzheimer's. We will have a fix for a lot of stuff. The one thing we have no fix to is our skeleton, so arthritis. Now it's still knee replacements. So with a weighted vest, so long as the weight isn't too much that it's going to add to that problem that we have no fix to.
Joint pressure and things like that. Okay, that makes a ton of sense. Cold plunges.
Stay.
Red light therapies.
Question mark. I don't know yet.
Okay. What is your hesitation?
So to me, it's similar to when we talked about how glutathione versus NAD. So the red light therapy is sort of that. It helps. It's like a conjunction with collagen to strengthen your tissue and all that kind of stuff. I just don't have enough data points right now to say yay or nay. So far, anecdotally, it's been okay. I've heard both sides of people that have actually tried it.
Did I miss anything that you think is trending? I think fiber might also be on that list.
Yeah, fiber's on the list. I think fiber is excellent for gut health. There's a huge debate about the benefit of fiber for any other nutritional value, right? I'm a big fan of it, and I think it's hard to eat it. That's why I do like the green shakes, especially now, because of the folks that are on GLPs and things like that.
Okay, that makes sense. So closing out, doctor, I wanted to embarrass you a little bit by quoting one of your colleagues who said that if your career has been defined by anything, it's teaching and mentorship. no doctor in the country has taught or trained more primary care doctors, and that you believe your purpose is not only to train exceptional physicians of tomorrow, but also to teach Baker Health members how to be their own healthcare advocates. What motivates you to teach?
Well, thank you. I mean, I don't know if that's true that I trained the most. So there's a lot of excellent doctors out there that have done an excellent job in the training.
I can't say whether it's factually accurate, but it was said about you.
So, you know, I'll give you the reason why I love to teach. And it is this. I remember when I was in Brooklyn in my training, and I had gone one day and I was doing a neurology rotation. And I will never forget, there was a student there, and I guess the attending, who was the boss at the time, was having a terrible day. And this girl that was a student with me was in her rotations doing her stuff, and she ended up not wanting to do neurology because of how mean the guy was to her. And I said, damn, I will never do that. You know what? Not everybody is like that. And that's what was the switch. And I said, okay, forever, I'll just go ahead and I'll do it, and I'll do it the right way. And I fundamentally believe if you do the right thing and you're transparent and you say and act exactly what you do, you can't do wrong. Even if you make a mistake, people know it comes from the right place. And so that's my impetus behind the teaching.
Well, I couldn't end on a better note. Thank you so much, Dr. E.
Pleasure meeting you.